this is Jay Grace, and I'm here with the well-renowned and respected plastic surgeon, Robert Grant. Welcome to our show.
Delighted to be here. Thank you very much.
And you have a book.
Yes.
Yes, right here. Can you pan here for a second?
Absolutely.
We don't want to forget about cosmetic surgery. Now, what made you decide to write a book, doctor?
The book is written in order to help patients really be empowered. Knowledge is power. This is a book that explores many of the topics in plastic surgery today, from the minimally invasive to the most invasive. The idea being that in one place, a patient or prospective patient can really investigate and learn as much as they can about what they're interested in and take that knowledge with them when they go for a consultation.
Now, doctor, in doing so, I'm sure there's been a lot of trends now that people have been talking about, particularly now since, because everything is so instant and everybody wants instant gratification, Botox, injections. Can you tell us a little bit about that? And we're going to later on, you're going to show us a little bit of what it's all about, but can you just tell us?
Sure. One of the great advances over the most recent decade in plastic surgery has been the availability of these minimally invasive or non-invasive treatments, which do give results in periods of time which don't necessarily correspond to what happens when you've had a nip and tuck cutting operation. So that's been a great advance. Things like you mentioned, neurotoxins like Botox or Dysport, fillers like Restylane or Juvederm are great ways to spruce up your appearance a little bit without having to undergo either an extensive procedure, have an extensive recovery, or have an extensive cost that can sometimes be associated with a bigger operation.
And with plastic surgery, like I said, a lot of people now they want to look their best, and that's wonderful. But what are the realities of plastic surgery? I'd like to know that.
That's a wonderful question. At the end of the day, the plastic surgeon, like myself, can really just move tissue around. We can't change your life, but we can partner with you to help change your life. And I explain a lot of that in the book. That's my philosophy is called Life Stage Personal Enhancement, which really means that anti-aging is impossible. Going back to Ponce de Leon, this magic elixir in order to turn back the clock is just a fantasy. But what we can achieve today, I think if we aim therapies at where a person is in their particular life, is help people look as good as they can for where they are in their life, what their life experience has been, what lifestyle choices that they've made. So plastic surgery today, when we talk about the cosmetic side, is really about partnering with patients so that we can help them make choices that will influence the way they look. Some of those have to do with the treatments like Botox or fillers. Others, when patients get to the point where they've done as much as they can with diet or exercise, they're going to need to consider having an operation. Many things along this line have to do with patients who are trying to get their body shape back after they've delivered childbirth, for example, or people who were born with certain things about their body that they had no role in playing, but they just happened to be dealt that deck of genetic cards. So those are issues where the operative side of plastic surgery works. But increasingly today, plastic surgery is less about the surgery and more about partnering with a knowledgeable person who understands what the different tools can do for you at each of these different points in time in your life.
And which is what I love about your book. You're very honest about the realities of serious plastic surgery, and that's so important because when you watch 90210, The Doctor, and it's a wonderful show, but they focus more on the glamorous part. They don't really focus on the recovery and how long it takes. And there's got to be, I'm sure, emotional factors involved in that as well that has not been touched.
You make a great point. The human body heals at the rate the human body heals at. And despite our comments before about there being things that can get people to feel better faster, an incision is going to heal at the rate that an incision is going to heal, whether it's 2011 or whether it was 1811. So people need to understand that we optimize your health around the time of an operation. We do everything we can to make it so that your recovery goes uneventfully. But there is a period of time that is associated with an operation. And most patients need to give themselves that period of time to recover. Our society is so rushed nowadays that we all think we can just jump right back in. And many times you're not doing yourself any favor by trying to get into work situation or a social situation before your body is really ready to take that on.
And from the way you're talking, you're very about empowering your patient and having an actual partnership with patients. What if someone out there is looking to get something done? What should they ask?
Well, the partnership question is fun for me because I've now been in practice long enough that I have examples of having taken care of generations of patients in the same family. And that's one of the things I come to really enjoy about my work is I take care of the grandmother, the mother, and now the daughter, maybe somewhat the same issues, maybe somewhat different issues, but that degree of trust plus taking care of the same patient as they age and go through the different life stages is also a benefit. If you meet me in your 20s for a particular problem, and now you're in your late 30s or 40s, a different set of issues come up. But we've worked hard to educate you as to the realities of the process. So it is a real shortcut to getting you where you want to be, giving you that degree of comfort and expertise that I'm going to be able to bring to the table at the time of the consultation. What you should be thinking about for yourself is really thinking about trying to be as specific as possible at the time of the consultation. So what I mean about that, and again we talk about this in the book, is that if someone comes in and says, I'm unhappy with my life, make me beautiful. Well, I can't do that. I wish I could, but I can't.
You get a lot of money. Right. You could do that.
but the reality is what I can do is I can explore with the patient some particular specific things about their body image that they might not be comfortable with, or that if they could change, we could change. It's not to say that I can change everything, but
sure.
If I can get the conversation focused on a very specific anatomical component that I know I can address with one of my operations or one of the minimally invasive procedures, then I know that I'm going to have a happy patient, and a happy patient is what I'm in this business for. It doesn't do me any good to operate on somebody who doesn't have a realistic expectation of the result, or to promise something that isn't, realistically going to be achieved.
I've noticed, we have a lot of celebrities now who've done an enormous amount of work, and how do you, as a physician, I would imagine, who may have a patient that is asking a lot of stuff, to the point that it might be addictive, how do you handle that?
So that's a great question. And the first way to answer it is if someone comes in with a picture of, Angelina Jolie and says, I want to look like this, I'd say, well, I can't make you look like that. You didn't have the same set of parents that she had. There is a genetic component, to these sorts of things. But realistically, if a patient does say that, it reflects a lack of understanding about what's really possible. And we spend a lot of time together to really explore what their motivations are and what it is about their specific body image that we can change, maybe using an Angelina Jolie or another high-profile celebrity as a role model for perhaps a particular look or something that we might be able to work towards without giving that particular result. Celebrities are celebrities for a variety of different reasons, but most celebrities are celebrities in a two-dimensional world. TV, internet, the movies are a three-dimensional world collapsed down into two dimensions. And we've all heard the term that someone is photogenic. There are people who look better in two dimensions than three dimensions. And if you've had the opportunity, as we do here in New York or on the other coast, of seeing a number of celebrities, I'm always amazed how often people say, God, they look so different in person than they do on TV. And I bring that information to my consultation with the patient who maybe is mentioning a celebrity as a potential reason for that they're interested in something. And I say, look, those people who make their life and livelihood as a celebrity do things in order to make themselves look good on TV on the small screen. You and I, who aren't making our living in that particular way, want to look good in three dimensions. So what might look good for a particular starlet or actress isn't necessarily what's going to look good on you as you go about your work as a professional or a spouse or just as a good old regular person. So it's a matter of defining, what extremes celebrities have to put themselves through, in the same way that a marathon runner trains many miles before. Right, and that's not to say that you too couldn't do that if you wanted to, but there's no magic that's going to make it so that you can go out and run a marathon as fast as the quickest runner in the world by going to visit a sports guru or whatever. You have to put in the energy and the effort. So it all goes back to information and education. I think it's great that there's all these other examples of people who are very happy with going through the process. On the other hand, we're flooded with images, we're flooded with information, and one of the reasons I enjoy these sorts of conversations is it allows me to help educate people about what the real story is.
Yes.
And again, the book goes into this in great extent.
Which is a great, great book. Where can we get it?
The book's available on Amazon.com.
Awesome.
So that's just log in and the title and the author's name, Grant, and you'll be quickly taken to the order page.
Now, we're gonna take a break, but after that, we're gonna go and actually look at some of the things that you have.
Fantastic.
All right, doctor. What do we have here? Can you just let us know what's happening here? I feel there's things, boobs there, but you're the doctor. Explain to us.
So in front of us we have a variety of different types of breast implants, ones that we can use for both breast reconstruction if necessary, but more importantly for breast augmentation or breast enlargement. And they come in two main types. They come in a saltwater type or a silicone gel type, and they can come round or they can come contoured to assume some of the shape of the breast, particularly useful in patients who don't have a lot of the normal curves that a breast have. Mm-hmm. They can come with texture on them or they can come smooth. And while this may seem to be a lot of choices, the doctor can work with the patient to choose which particular style and shape works best for that patient's particular goals and for the particular body that they have, that they bring to the consultation. The silicone implants have been back on the market in the United States for the past 4 years. It's the kind of implant that has a liquidy sort of silicone in it. Outside the United States, there's a gel that's a little bit more what's called cohesive, and we're looking forward to the time when the FDA approves those implants and lets us have access to them on a wide basis here in the United States. That's sort of the new and exciting potential upgrade that we're going to see with implant technology. But for patients who are interested in having their breasts enhanced, the surgery has become very popular again, and it's very successful. There are some things that patients do need to know, of course, and the first is that the implants don't last forever. Okay. So if you agree to have an operation like this, you have to understand that at some point you're going to need to have another operation, hopefully down the road many years, in order to remove the implant and replace it with one where the shell hasn't weakened and either the salt water has gotten out or some of the silicone is no longer within the envelope. Having said that, that's not necessarily the worst news because our bodies change as we age. And while I would love to have the same physique I had 10 or 15 years ago, I don't. And most women, because they also have the extra burden of dealing with being the person who actually has to physically bear the child, their bodies experience dramatic change during pregnancies. So the fact that you need to have your implants updated at one point isn't necessarily a bad thing. But it's important to understand that that's part of what is involved when you agree to have implants placed in the first place.
And just to go back, doctor, I know that a couple of years ago was a big scare with silicone. And there you go. What's changed? Can you tell us about how safe it is? And
what's changed about the implants is the fact that we have a lot more science behind their use. Okay. So they've been studied probably more than any other medical device in the history of medical devices. And in fact, the study is ongoing, the one that was started in 1991 by the FDA, because the manufacturers had not, for a variety of reasons, done the necessary sort of proof that the implants were safe before that point. That wasn't anybody's fault. It's just that the rules back in the early 60s when implants were developed weren't as specific and the requirements for getting devices approved aren't as strenuous as they are today. So we know that implants leak. We know that they can get infected. We know that scar tissue can form around them. We know that there can be differences one side versus the other for reasons we don't understand, which allows us, again, to empower our patients by informing them of all these things. The vast, vast, vast majority of patients who have this operation are very satisfied. And my job is not to judge whether or not it's appropriate for you to make that choice or not, but for you to understand what you're getting into, and then should you decide that the operation is for you, to make sure it's done in the safest, most effective way possible.
Fantastic. Now, doctor, size, which matters, I guess. for instance, my frame, I'm petite. Double D's, would that work for me?
That's it's an excellent question, and part of the consultation is learning what the patient wants in terms of what they are desiring in terms of the enhancement we can give with implants. Mm-hmm. Most patients aren't interested in the sort of look that would be more appropriate on someone who is making a living as an exotic dancer, for an example. Most women don't want a shape where the breast is very round up on top. And we have some new tools to help image the patient beforehand. Mm-hmm. We have a new 3D camera that can actually allow us to morph images on specific implants, so we can give the patient never an exact representation of what they might look like, right, but one that's pretty close to what a different size and shape implant might mean for them. So that's how we do it. There are some anatomic considerations in terms of exactly how wide your chest is, and the implants all have a base diameter, so we don't want to put an implant in so big that it starts going out into your armpit and interfering with the range of motion in your arm. Right. There are other factors like how tight or loose your skin envelope. So the doctor goes over all those in the consultation, and as I said, the computer software, in combination with these 3D camera images, allows us to give the patients a very good representation of what they might look like if they decide to have the surgery.
And what are the different types? Like, there's ways that you can do it. You can do it through the belly button. You can.
So that's an excellent question.
Yeah.
You asked specifically about the belly button. Mm-hmm. That's one way of doing it, although I would say that most patients don't have it done that way, because it's only if you're going to use saltwater implants, because the saltwater implants are only filled up once they're put inside the breast. But if you're at the belly button and then trying to make a tunnel to get the implant in to a pocket that you're making from a distance, it can be very challenging to get the exact size and shape that the patient wants. The other thing is that the implant itself, the shell, can be traumatized if it goes through this little tunnel. There's a special tube that you have to kind of use a plunger to push the implant in. So while it's great to have an incision remote away from the breast, there are some downsides to doing it that make it the least popular approach that plastic surgeons use with their patients. Other approaches include incisions around the bottom of the areola so that there's no scar on the non-pigmented skin of the breast. You can put them in through the armpit, which is a little bit like the belly button, except it's closer to the breast, so it's not as difficult to do. But again, if the patient raises her arms, you're able to see the access incisions in some patients, which is a little bit tricky. And then the workhorse incision for silicone implants, because they come pre-filled, is the incision which is made right in the fold where the breast meets the chest wall. Because that's a normal body crease, the incision heals well in the vast majority of patients. And in that way, we can put the implant in, get directly to where it wants to be, make our pockets as symmetric as possible.
And what's usually, for that type of procedure, the healing time for that?
The operation takes about an hour and a half. Most patients feel as if, not so much that they hurt, but it's like when you've worked out too much and then that next day you have that muscle soreness. So you're fine if you're staying still. It's then when you start moving your arms that you might be a little bit uncomfortable. Within a couple weeks, most patients are pretty much back to normal activities. And most of the time I wait a month just to be conservative before I have my patients start doing any Pilates or yoga or stretching, things that are going to potentially put some force or stress on the healing scar.
Yeah. So now we have this, and you can tell us it's an injection.
We talked before about some of the minimally invasive or non-invasive products that are available, and this is an example of one of them. This is a filler that we use, the common type. This one is the Juvederm line of products, and these are great for filling up areas of contour deficiency in the face. What I mean by that is we've learned that aging is associated with some loss in the normal fullness of the facial features. Everyone knows how a little baby is cute because they've got those chunky cheeks. So we can use these materials, which is the same material that our bodies make in order to fill up the spaces in between the cells and the collagen. So it's very well tolerated with a very impressive safety profile because we're injecting the same stuff that's already inside of us.
So less chances of allergic reactions or anything
Correct.
like that? Okay.
Exactly right. And what's great about this is that we can just take it off the shelf and inject it. It's you get to see the results right away. And it's wonderful for areas like along the line between the corner of the nose and the corner of the mouth, where nature has created a little plane where some of the tissue gets pulled down as we age. We can plump that up and make people's faces look a little bit more rejuvenated. This isn't the only product that's available. It's just one that is easy to demonstrate its use. Other things that people are using are taking little pieces of one's own fat and using that to inject, which is very exciting because tissue, when you transplant it like that, can actually, new blood vessels can grow into it, it can become alive, and it seems to interact with the skin in ways which has results that prolong the effects more than just having the volume added from the fat cells that you're transplanting.
It's like they recognize each other and they know that they're in the family, it's okay.
Right, so that's one of the very exciting things about cosmetic surgery of the face is how sophisticated the science is behind fat transfer and the particular cells that are in that fat. They're called stem cells. It's an exciting, science advance. Not to bore your viewers with too much mumbo jumbo, but it's something that is undergoing a lot of scientific inquiry, and it started with use in the face, but we use it in other areas, and people hope someday that it'll allow us to customize, maybe even reconstructing a breast or another missing body part with these sorts of things. We're not there yet. We've got years of good research to do before we do it, but the use of fat, because it's from your own body, it doesn't reject, and because most of us have a good donor supply, is an area that is very exciting.
Oh, wonderful.
But back to this particular material. So the doctor, under sterile conditions, would identify the area that needs to be filled, and then once they get into that particular plane, they would inject this particular material so that we could plump up the area of contour deformity very nicely, and because the material is viscous enough, it really allows the results to be ahead.
Oh, it's very smooth. It's almost like a little lotion.
Which is why it works great, so that when it's injected, it can be massaged so that there are not lumps and bumps that result, if the doctor isn't absolutely perfect in getting the little needle injected right to the place where they want it to be.
And how long does that last?
They make this product in different formulations that have different amounts of cross-linking. For most patients, these products last somewhere between 6 to 12 months. Interestingly, the products interact with your own facial anatomy. And what I mean by that is if you put the material in areas where there's a lot of motion, the material doesn't seem to last as long as if you put it in a place that isn't moving as much. So, it varies, and you get to learn how the patient interacts with the material, and then you can kind of figure it out from there. Most of the time we treat at first and then wait until the patient begins to see a little bit of loss of the filler material. We don't like to have them go all the way back to baseline, because then it's sort of this pendulum swinging. Yeah. So what's nice is that the patient comes in before the effect is completely gone, and then we can usually use a little less material in order to get them back to where they were, as opposed to having to go all the way back to the beginning.
And so is there any discomfort or anything? How to...
The way that these materials work now, some come actually mixed with some local anesthetic in it, which is very nice. That's a good advance. Most doctors, like myself, have the patients apply some topical anesthetic gel or cream before we treat, so that the area is numbed a little bit. They're not entirely painless. It is a little bit of a needle stick, but it's very well tolerated. And because the size needle we use is so small to inject it, the vast majority of patients end up without any bruising or any side effects of having the medicine injected. We usually ask that the patient not do anything too exertional that evening to allow the area to settle down. But
so if it's in the face, someone starts screaming or...
Right, or standing on their head or going to a spin class that night.
Right, exactly.
But usually by the next morning they're good to go.
Oh, how wonderful.
Yeah.
Oh, doctor, you've been so wonderful in educating us and empowering us that if we're going to make a decision like this, to ask questions, get to know your doctor, and have a partnership with them. And if you want to know more about this, I'm going to come over here for a second and get his wonderful book. It's available on Amazon. Thanks again, Dr. Robert Grant.
My pleasure. Thank you very much. Thank you.